Hi, I'm Dr. Jim Carlson, in reference to case number 01377, 1-year-old Schnauzer with symptoms of chronic limping. If we look at original test results, we see that on this side was the original test, and this side was the results of 3 months of rebalancing. And we can see that this number right here, the circulation point, stayed about the same at 46. But as we come down and see the 2 stress points here, we see those corrected. And those are related to lymph drainage. And lymph drainage can have a direct impact on circulation, but those corrected, and we still see that there's another layer. And so the second page, we see stress points here related to again, the lymph system corrected. We get down to a number of the other areas, governing vessel, certainly the descending colon, those corrected as well. So we see that most of these corrected. We get down to the prostate, urethra. We see that went from stress to just mild chronic weakness there. So for the most part, we corrected the original imbalances because he was limping back in May as well. But we see that there's another layer to this. So as we go into the next phase of this, the next layer, we see that we do have allergies to chemicals at 45. And we do see there's a consistent weak circulation. And so those two areas combined with allergies, we've got imbalanced pancreas, spleen, pineal gland, and then urethra. And so symptoms are chronic limping. The pattern is chi stagnation, where we can't get good nerve and blood flow to the muscle and the legs and the back. And if we get down to our diagram here, we can see that if we're dealing with gait and movement, tendon ligament is related to liver, cartilage and bone is related to kidney, and muscle is related to the spleen and stomach. So we have representation of urinary bladder here, pancreas over here, but most of which circulation and endocrine function is going to be up here. So if we add allergies as the tipping point, we're going to see that in this circulation area is what we have to rebalance. And so, first of all, what do? Well, we want to get this little guy feeling better and moving around a little easier. So we're going to choose an anti-inflammatory, short period of time to reduce inflammation and improve gait. Number 2 is we're going to help with chi stagnation by giving him a product called Body Sore. And Body Sore helps to relieve some of that tight muscle and improve circulation. But ultimately, we want to rebalance, and so we're going to use a product that helps with that. Lymphodrainex at 2 drops a day for those infusion points that I talked about to rebalance, and we're going to treat him for 3 months with that. Body Sore for 3 weeks, and an anti-inflammatory for about 7 to 10 days.